Alka is going to talk about vitamin D, its importance, and so on. And everyone here knows Alka. I doubt if there is anybody here that doesn't know Alka. And just I want to also mention that in case you are in Montgomery, the Maryland or Virginia, Alka is also conducting this Nadi Pariksha sessions every month. There are about 20 people that she evaluates Prakriti and Vikruti, and those people that have attended those sessions, they feel amazingly important and very helpful information. So if you are in this area, please let me know, and I will schedule you for her sessions. Okay, so every month there is one session. Okay. Um, and Alka, you know that all her qualifications, and I think I don't want to go over this again. So Alka, go ahead. You go ahead and start. You can introduce yourself if you feel like. Okay. Thanks. Sorry.
Yeah, thank you so much, Kaka, and thanks for this opportunity. It's always a pleasure to have or give a small presentations on Shri Yoga, because there are so many experts already here. They are already in they're improving their health already with the help of Sabnis Kaka, and there are very highly educated people here, and I actually learn a lot from this group also. So, and this presentation I had done this before in another platform, but it was in Marathi. So today we are going to cover, there are 1 or 2 slides I have added extra, especially for today's session. So today we will talk about the main thing, which is in trend right now, about the vitamin D. We always hear about what vitamin D is and what those points are. So we are mainly going to talk about its importance and what is the what is why we should be taking vitamin D, and how much should be taking, how much it is actually necessary, and all those factors. And we'll take the questions at the end. So if you have any questions, you can post it in the chat, or you can at the end you can actually ask by raising your hand or jumping in. So to give a small introduction about myself, I'm a registered clinical herbalist with American Herbalist Guild and also board certified in holistic nutrition. I also have my background, or the work background, which I also work at the compounding pharmacy in the formulation and compounding at my doctor's pharmacy in Herndon, Virginia. And they have a wellness center, which is called Juno Wellness, and I have my independent practice there. I take online sessions of the evaluations as well as in person mainly on every Fridays. Just to give you the idea that this presentation is strictly going to be for the educational purposes only. And if you have any, if you have always, if you're trying to change anything basically to your diet or nutrition, and especially the supplements also, make sure that you are consulting your healthcare provider. It's important for your doctors to know what you're changing, especially if you are on any particular medications and if you have any particular health condition as well. Okay, let's see if I can. Can you all see my slides moving?
No, I don't see.
Cannot see.
Okay. Now it is the next slide. Yeah. Okay.
All right. So let's understand first of all what the vitamins are, what exactly vitamins are, what do you mean by vitamins? So vitamins means it's a some kind of a vital chemical compounds or organic compounds which are needed for our development, which is needed for our growth. And it's essential for our good health, basically. And there are 2 types. There are called micronutrients and there are also macronutrients. So micronutrients are the ones which goes under the vitamins come under the micronutrient categories. The macronutrients are basically the one which we take it orally in our food, which is mainly your proteins, carbohydrates, and fats. Those are the things which come under the macronutrients. And the micronutrients are the ones which provide the constant support to your body. It helps to produces your defense system, develops your defense system. And it's necessary for the health of our cells as well. Now, when you consider the vitamins, there are basically 2 categories, or rather vitamins are divided into 2 categories. One is the water-soluble category, and the second one is the fat-soluble category. Now, the vitamins which are vitamin C, vitamin B complex, they all come under the water soluble. That means once you take them and when the urine is passed throughout the day, the content of the whatever is necessary gets absorbed and the other ones get flushed out, especially if you're taking the supplements. This is one of the questions which has usually been asked, that so when somebody is taking the B complex or the B vitamins, the urine usually turns yellow. Some people freak out initially if they don't know why when you're taking B complex, why your urine is turning yellow, which is very, very normal. B complex does contain the riboflavin, and riboflavin gives you that little bit of stronger smell and as well as the color to your urine. So that actually shows that whatever you're taking is getting absorbed and getting flushed out what is not needed. So those extra water-soluble vitamins are done that way. They are not stored permanently or not stored for a very long period of time. Now, the fat-soluble vitamins, which are A, D, E, and K, and we are going to talk about mainly D and K. K is not very well known, but we will be emphasizing more on D and K together, why it should be taken together today also as well. So those are the vitamins which are, when you say fat soluble, that means these vitamins, when you take it in a food form or the supplemental form, when you take it enough to begin with, they are actually stored into your liver. And after that, whenever it is necessary, they get used. So usually vitamin D, if you have seen, it's not given for when somebody is on the prescription also. It's not given for a very longer period of time. Usually the prescription is once a week prescription, and they are given for 4 weeks, 6 weeks, depending upon the need. And then after that, just for the regular maintenance, you can take as per the case to case. Usually 1000 IUs of D is more than enough to take it either daily or alternate days, depending upon your use and capacity, and also depending upon your condition you're facing or if there are any health ailments. Now, the water-soluble vitamins, as I said, they must be regularly consumed, and fat-solubles are stored in the body, so they can be taken or consumed in a particular interval of time is also fine. Now, most of these vitamins cannot be synthesized by our bodies, and the best example of that is the vitamin C. So if you see the other animals, like mainly the most of the animals, I would say, they can produce their own vitamin C. So they have a capacity of fighting or defense. It's a natural defense for them to produce against any kind of infections or whatever, or if they're exposed to something. But for us, vitamin C is one of the examples where it's not produced naturally inside our bodies. So that's why you have to take it either in your dietary form, or if that dietary form is also not enough, then it is being given or taken in the supplemental form. Now, when it comes to the vitamin D, this is always a debatable thing. It's been always under it's a very healthy topic, or rather very interesting topic of debate for most of the experts of nutrition, as well as some biochemists also they are also debating whether this vitamin D is a real vitamin, or are you going to call it as a vitamin, or you are going to call it as a hormone. And the reason behind that vitamin D is mainly produced inside our skin. There are other two ways also, but it's mainly produced inside our skin through the sunlight exposure. So you get it from the sunlight, and it first interacts with our receptors. So all our skin has their receptors, the vitamin D receptors. So what do you mean by receptors? So it's the type of, we call it as, they are the helpers to help the vitamin D to catch or to hold it, and then bring it back or to the site of action, or whatever site has been necessary for that conversion. And that has been done, or this kind of mechanism is done mainly for the hormones. That hormones always have the receptors to it. Now, if the vitamin D needs the receptor, then how come we are calling this as a real vitamin? So it's a debatable thing. So some of the experts consider the vitamin D as a hormone as well. So it's been classified not just as a vitamin, it's also classified as a hormone. Now, when it comes to the vitamin D, it's just like, say, for example, my last name is Deshpande. So when I'm calling myself Deshpande, that means when I say the Deshpande family, that means it's Alka Deshpande, Shailesh Deshpande, Rasika Deshpande, Atmika Deshpande. So we are made with all these, the group of family of 4, which makes the last name Deshpande. So similar way, vitamin D refers to the family of major 2 compounds, which is D2 and D3. And we are going to talk about each one of them separately and what their importance is also. So vitamin D3, which is also called as cholecalciferol, which is synthesized from cholesterol in your sun exposed skin. So you get that cholecalciferol or D3, you get it directly from your sun exposure. You also get that from your diet, and it's not a very high amount or large amount in your diet. The amount is pretty small, but you naturally get it from eggs, fish, and also the animal liver. If you're a non-vegetarian and if you're eating all that, you usually get the dietary source of vitamin D3 from there. Now, D2, which is also called as ergocalciferol. So it's synthesized by certain type of fungi or fungus, and they are used in the supplements and also in the, when you say fortified food, so it's basically a vitamin or vitalized food such as milk or butter. So they add the external or the artificial form of, or the lab-made form, you can say it as, of vitamin D added in the milk. So if you remember a few years ago, vitamin D2 was given in the prescription form, where people were taking that 10,000 IU, 50,000 IU prescription every week. Now that is changed to the D3 because more research has been done on that. And then it has been shown that instead of D2, D3 might be more beneficial for people to take it, or it's more bioavailable also. So the other prescription form, which has been seen commonly in some individuals, and I'm not sure how many of you take such type of things, but there are certain category of people, or they have certain type of kidney problems. They usually take the calcitriol, and it's very commonly prescribed drug form of vitamin D, and it's very, very potent actually. One of the potent forms of vitamin D. It is 10 times more potent than D2 and D3. And we are going to see why this potent form is given in the form of prescription, and why to the people only which has who have, or individuals who have compromised kidney functions also. But these are the common forms you see: D2, D3, and calcitriol also been given in the form of a prescription. Now let's talk about why vitamin D3 over D2. As I said, in past, if you see, the prescription used to be D2, or it has been given with D2, but now it has been seen with the new research that vitamin D3 is actually a more favored form for the humans. So we actually get the bioavailability or the absorbency, you can say, it's more favorable for our bodies. We get that absorbed pretty quickly, and the bioavailability is almost double that of D2. Because not every individual has that capacity for conversion from D2 to D3. That's just like thyroid function. They have the conversion from T4 to T3 needs to be happened in our cells. Similarly, in similar categories, that some individuals may not have that capacity from D2 to D3. And so D3 is the most bioavailable form, which has been given in the form of supplements or in the form of the prescription medication also. Now let's look into how this D3 is it usually gets absorbed in our system, how it has been transported from sunlight and also through our diet. So as I mentioned before, our skin actually contains those precursors or those receptors for vitamin D, and those are known as 7-dehydrocholesterol. And when your sun gets exposed to the sunlight, or when your skin gets exposed to the sunlight, this compound's job is to convert whatever has been exposed to the sun. It gets converted into D3, which is called as cholecalciferol. So once that gets converted, this conversion usually happens in your liver. Basically, once that conversion happens, then it goes it makes its path further down to the liver. When that gets transported to the liver, then the job of the liver is to get, or rather to convert whatever is the form of that D3, that gets converted into, it's called as 25-hydroxycholecalciferol. You don't have to remember these names. It's just 5 times more potent from whatever was absorbed first initially on our skin. Now, to make those conversion, or to do this conversion, usually liver does that with the help of a particular enzyme. So that's another reason why your liver health also is a crucial part when it comes to the vitamin D conversions, or vitamin D absorptions at the same time, or even at the storage, when that storage of vitamin D is necessary. So liver health is equally important. Liver is a great organ, and liver is one of the best organs for the detoxification, which our body does always. And for the liver health, the B vitamins are very necessary to, or rather for the enzymatic action of the liver. So B vitamins, if a person is having an issue of the liver, the B vitamins are usually suggested to make sure that that liver function is are happening well. So to talk about back onto the vitamin D, once that initial D3 forms gets converted into 25-hydroxycholecalciferol, which is 5 times potent than the initial one. And when this is the part when it happens from your sun exposure to the skin. Similarly, the same thing happens from the dietary sources as well. When you're taking the dietary source of vitamin D, that also passes through your intestines, goes all the way to the liver before it gets converted to the cholecalciferol before it reaches to the liver. Now then, after that, when it comes to the liver, that part of the liver is done, when that 5 times more potent form of the vitamin D is formed, then it starts its way towards the kidneys. And that's the most important part. When if you go back, why that prescription has been given for the people who have compromised kidney function is because of this reason, that when it moves back to the kidneys, then with the help of specific enzyme with the help of that particular enzyme in the kidneys, it gets further converted into the another like more potent form, which is called as 1,25-dihydroxycholecalciferol, all the calcitriol which you saw, cholecalcitriol which we saw in the prescription form before. And that is almost 10 times more potent than the initial vitamin D3. And it's one of the most powerful than its precursor. It's like highest or the most potent form. And when people have the compromised kidney function, there are some people may to a capacity where they cannot produce such kind of things, or they cannot do the conversion like that, then the prescription of that strongest vitamin D3 is provided to them. So usually people with the compromised kidney functions, or when somebody has a high diabetic issues and they are on certain medications and their kidney functions are under watch by your doctors, they usually also do the examinations or the testing of the vitamin D at the same time. Now, once that 1,25-dihydroxycholecalciferol, which is one of the most potent, 10 times more potent form of the vitamin D is formed, what is the use of it, why it is, or how it has been used further? So the job of that most potent form of vitamin D, it's first of all, it promotes the calcium resorption in your bone. So when it comes to the remodeling of your bone, when it's supposed to be getting the new modeling of the bone is done, so the part of that vitamin D plays over there, that has been it's been used to do that particular job. The second and the most important part also, that it stimulates the calcium reabsorption into the kidneys. That means the amount of calcium which is not needed for our body and needs to be out from our system, that stimulation of that calcium is done in the kidneys and gets reabsorbed into the kidneys and then taken out again. Otherwise, if that calcium is just moving around in the system, that the calcium can start depositing into the soft tissues, and it is more dangerous for the body for the overall body. The third and the other important part, that it also promotes the calcium absorption in the intestine, because our serum also or our blood also needs to be or it needs to maintain a certain amount of calcium. So its job is actually to promote that calcium absorption in the intestine. Whatever is not needed is being taken out from the kidneys. So vitamin D plays a very, very important part when it comes to the bone health. Also, the maintenance of that calcium level inside the system. Besides those two, there are now, with the new studies, there are multiple other functions of vitamin D, which we'll be talking about shortly. Now, as I said, when some people or some individuals have chronic kidney disease and also have a liver disease or the liver problems, that's the time when vitamin D levels have to be watched further carefully to see what your numbers are. Now, when you're saying that what is the optimal level of the vitamin D, usually the vitamin D strengths are being given, or the ideal lab number which has been given in our blood works starts from the lowest value as 30 and goes all the way towards 100. So there is a vast range. It's like a very broad range to be considered to maintain our health. So when the doctors see the numbers going below 30, then they usually tell patients that, okay, this is something you need to be focused on, that you have to either start taking vitamin D in your supplemental form, or you have to take it in the prescription form, depending upon the need, and also to increase the consumption in your dietary form at the same time. Now, if you ask me what would be the ideal level I will go for. So for the individuals which are trying to keep themselves or trying to maintain their health in the proper, in the ideal situation, I would try to maintain ourselves in between 40 to 50, just to be as an ideal range. If you ask me, have you seen any vitamin D toxicity? Honestly, I have not. But there are rarely seen that the numbers of vitamin D goes above 100, unless and until somebody is taking a very, very heavy dose every single day for a prolonged period of time. Now, there are some research, very, very interesting research findings in the osteoporosis also. When it comes this osteoporosis, specifically, I'm talking about the women who are menopausal or postmenopausal. So there are very high levels of 25 hydroxycholecalciferol. So that 5 times potent form of the vitamin D is been seen higher in comparison to 125 dihydroxycholecalciferol. So why is it been seen like that, and why it's not getting absorbed properly into the bones also? So there are possible factors they are relating that towards it could be because of the imbalance of estrogen, which has been seen after the menopause, and also the magnesium deficiency. So usually it has been recommended just to take a small amount of magnesium at night in the spray form if you are having any cramps or having any other muscle issues, but the oral magnesium form is also been recommended. You can also take it there are really good dietary form of magnesium. You can take it from your food. So that's another recommended or rather recommendation for especially for women who are aging or who are postmenopausal or menopausal. Now let's look into the functions of vitamin D. What are the different type of the functions of vitamin D, what we should be considering as? So first and most important, as I said, the bone health we all know about. Now the other important function for of vitamin D is the regulation of calcium and phosphorus level in our blood. And how does it matter to maintain the calcium and phosphorus level, or rather, why does it matter to maintain the calcium and phosphorus level? Is because of the importance for your strong bones, muscle contraction, and general function. So overall, we know that our bones needs the mineral. They are made with the minerals. So these minerals, or the phosphorus is a type of that. So those calcium and phosphorus ratios are important for our stronger bones, and to make sure that the calcium is getting absorbed properly inside our bones for the remodeling of the bones. That regulation is important for the calcium. And that's another reason that maintenance of vitamin D is very important. That's the initial reason why vitamin D got a focus on that, why you should be taking regular vitamin D, or rather maintain the vitamin D levels. Now there is a lot of multiple research done for the vitamin D, why we should be taking it, and we'll be talking about that. But how is it been seen that how do we maintain, or rather, how do you know whether the calcium levels have been fluctuating? So usually what happens is, if you're aware, or if you have noticed, or if you have seen, there is a blood test which we call it as PTH. PTH is a blood test which has been given for normally with the patients normally with the individuals who have liver or kidney functions, or even in some individuals who are diabetic at the same time, or even for women who are trying to see where their hormone levels are. So what is that PTH means? It's called as a parathyroid hormone. So does it have a relationship to the thyroid? No. It's actually a parathyroid gland because it is the way it has been situated, or it has been located. So what does this parathyroid gland does, or what does it do? So when there is a decreased levels of calcium in your blood, the body actually sends the signal to the parathyroid gland in the form of the parathyroid gland. It senses, or it gives us an indication that when the PTH hormones or PTH levels are on the higher side, when it is going higher, that means the body actually activates the vitamin D with that signaling of PTH, and then it actually enhances the intestinal absorption of calcium, and it actually reduces the calcium secretion by kidneys. So that means that our body needs to maintain the intestinal absorption, or needs to maintain the level of the calcium inside our blood. And this is the way the PTH and the calcium is related to each other along with the vitamin D. So in very lot of most postmenopausal or menopausal women, or also in the cases of osteoporosis, in the cases of kidney functions, in the cases of kidney maintenance rather, the PTH hormone levels are important, or it has been always checked in the blood work. Now, another important form of vitamin D, or important function of vitamin D, is to helpful again the controlling, or helpful against controlling the inflammation in some of the diseases, which like autoimmune diseases. And this is the very new studies which are coming up now. So in how does it directly work on those diseases? It actually controls it actually controls its inflammation by controlling the immunosuppressant factor in that flare-ups. So mainly people who have rheumatoid arthritis or multiple sclerosis, or even with the type 1 diabetes, or ulcerative colitis or Crohn's disease, this vitamin D can act as the immunosuppressant for reducing the flare-ups. So this is, again, these are very new studies which you can find in I have shared one of the articles here, but there are lots of different more studies still getting performed to see how the vitamin D can be important also in controlling the autoimmune or the inflammatory diseases. Now, this example of increases the resistance to the infections against any particular, or especially with the viral, respiratory tract viral infections, vitamin D was extremely, or rather is extremely useful. And we have seen this example in the during our COVID breakout, or during our COVID pandemic. In countries like India, it used to be a protocol of giving the high doses of vitamin D for 3 days straight, with a pretty high dose of vitamin D for 3 days straight to fight against that infection. And even here, when people used to come at the pharmacy to pick up their prescription, this was one of the recommendations given, that make sure you are taking your good dose of vitamin D to fight against that infection. So vitamin D is proven, or rather is very well known for fighting against the bacterial and especially the viral infections which are impacting your respiratory health. So even when you are catching up any kind of simple cold, or if you are not sure about if it's allergies or even cold, but if you are, especially in the cases of flu as well, if you start the vitamin D right away when you get that first tickle in your throat, usually when you're about to catch cold, the first thing which affects is your throat. Your throat usually starts getting scratchy, itchy, before your nose gets running. So when you get that sensation, if you start the dose of vitamin D, say about 10,000 IUs a day for about 3 to 4 days straight, and then you can stop. So these are one of the recommendations which were given during that particular period of time when you're fighting against the viral infections. Along with vitamin D, of course, vitamin C also is being taken in the form of food or in the form of supplement. But vitamin D is very helpful when it comes to the again, defense against the viral infections. Now, this is another interesting part, that it's also helpful with the cardiovascular health, because our heart also contains some vitamin D receptors, and it's important for maintaining the healthy heart function as well as your blood pressure. So if you are taking or if you are very regular, or if you are maintaining your vitamin D well, then it's also been seen that it's helpful towards maintaining your healthy heart function at the same time. And there is more research needed, of course, but this is an article which has been published in 2013 in American Journal of Clinical Nutrition. If you want to know more about that article, you can search for it with the 2013 review, and you will find some studies done on that as well. Now, another very booming part of mood disorders like anxiety and depression, this has been getting very helpful in those particular cases, especially in the winter months, when you do not have enough sunlight to go out and get exposed to, and especially in our areas where there are colder regions, you don't see sunlight, and you don't get the exposure to the sunlight. So it's an essential nutrient that plays a mood regulating part in the mental health. The cases of depressions, the cases of anxieties are more in the form of during the winter months, because of this reason that the exposure is less. So it's always a good idea to, before those seasons start, you can get your vitamin D levels checked and see where you stand. And you can actually start boosting up your vitamin D levels right before you actually hit the season. Because as I said, vitamin D levels, vitamin D is basically a fat-soluble vitamin. So it is maintained well in your body. It doesn't get flushed out the way the water-soluble vitamins do. So in that case, you can actually optimize or maintain that level right before the season starts and then keep it that way. But I mean, you don't get that much of an exposure while sitting in the window, but some of that at least you can get some of it, or you can get some of the exposure to the sun. So when this kind of lack of sunlight is there during this months, so try to get that through your maybe your supplement, or through your, if you're not vegetarian, you can get it through your food at some quantity at the same time. Now, who are the individuals or who are at the increased risk of vitamin D deficiency? That's what we are going to see now. So first of all, as I said, if you're on the very strict vegetarian diet, and I'm not against vegetarian, I myself is a vegetarian, I don't even eat eggs, but there are, when you are a vegetarian, you have to make sure that you have at least enough or inadequate sunlight exposure. If not, then you probably have to consider taking the vitamin D supplementations in the not regularly, but depending upon your number where you are. Aging is another factor, because as a person starts aging, it actually becomes less efficient for synthesizing the vitamin D in the skin if you compare with the young adults. So that aging is also another factor. Then if you have a reduced sunlight intensity, as I mentioned, especially in the colder days or colder season, particularly in winter, and if on the top of that, if your dietary intake is also low, considering yourself into a vegetarian diet, and your sunlight exposure is not there, you're not taking any supplemental form of vitamin D as well, then you are actually at the risk of getting lower into the vitamin D. And when you're at the lower of when you're at deficient in vitamin D, there are lots of different symptoms you're going to see, like not feeling any kind of no enthusiasm, or you're low in energy, aches and pains, lots of different things are seen in, and we are going to see the symptoms also, that what type of symptoms are seen when you are deficient in the vitamin D also. Now, another individuals who are with the fat malabsorption due to liver or biliary disease, if your fats cannot be absorbed well, because remember, these are the fat soluble vitamin A, D, E, K. So they also need a type of, or the good amount of fat to be stored. I'm not saying you should be fat or obese, but there should be a like optimal amount of fat for storing such kind of vitamins also. So if you do have a certain type of liver disease, or if you're compromised on producing a good amount of bile, or if you have Crohn's disease, also if you have chronic pancreatitis, so if you have inflammation of pancreas, or you have cystic fibrosis, then chronic kidney disease, then you definitely have a problem of having the maintaining the proper levels of vitamin D. So it's important for those people to get that blood work done, or the levels of vitamin D checked, and they take the necessary action of either asking your doctor or for the prescription, or taking the supplemental or the dietary vitamin D form. Now let's see the deficiency of vitamin D symptoms also. What are the symptoms which are, I've not mentioned all of them. There are so many of them. It's hard to, put everything together at one time with that limited amount, but with a time amount. But I've mentioned few of them, especially in adults. So you will start going to see some loss of bone minerals from skeleton, and you have an increased risk of osteoporosis and fractures. Now, osteoporosis is a very silent form. It's not going to give you any kind of aches and pains to begin with. It's a very, very silent form of disease progression, but it's going to start making your bones very brittle inside. So when the bones are brittle, then when somebody falls, the risk of fracture increases. So that's another reason why the fall is another prevention we should be looking into, especially in the elderly. Now, interestingly, the hearing loss and the ringing in the ears is also been getting connected, or also been seen in people who have deficiency of vitamin D. Now, that ringing in the ears could be connected, or can be connected to the inflammation part in the ears as well. I'm not talking about vertigo. It's a different part other than vertigo. But in those category individuals also, it's not a bad idea to check your vitamin D levels. Then the soft bones, when somebody has a very, very soft bone, just like osteoporosis also, when they have a spongy bones, at the same time they are weak and they have weak muscles and painful muscles and always complaining about aches and pains of overall bodies. And that's another good way of checking or talking about the vitamin D levels at the same time. Then muscle weakness, particularly around the hip, where that large area is, the hip and the pelvis. If you're having a lot of muscle weakness in that area, it's always a good idea to consider checking the vitamin D levels. If your immune system is impaired, if you're getting sick most of the time or every month or every season, if you're falling sick and you're catching infections very quickly, that means something is not right inside your body. And then that's one of the other factors to be considered is the level of vitamin D, to see if your vitamin D levels are very low or it needs to be boosted up. Now, when we were talking about the dietary sources of vitamin D, now there is this is a very controversial part. If you see the actual dietary allowance, which has been recommended, the RDA allowance is very, very low. It's only a 40 IUs per, 1 microgram is equal to, that's one of the 40 IUs is a actual scale, but it's very low in comparison to what has been needed for your body. And it's been noted that the infants which are up to the year 1, only 400 IUs is recommended as a daily allowance. From 1 to 70 is only 600 IUs, which are very small amount. And elderlies which are over 70 years, it's about 800 IUs. And the upper tolerable level which they have given is the 4,000 IUs. Again, these are the dietary, or these RDA values are depending upon the considering the bone health. So we are not only focusing on the bone health now, and these are the numbers which are been released way back. So the vitamin D is not only given for the bone health. There are various other reasons why vitamin D levels are now needs to be maintained well because of the new upcoming research as well. Now, if you consider the food and the serving, so as I mentioned that the main source of vitamin D is going to be through the sunlight. But there are some dietary forms also available of the vitamin D, not very high strength of vitamin D is being derived from that food, but there are some amount which you will be getting from the food as well. One of them are the most highly recommended form in case of category of food, it's the salmon and the tuna. So basically the people who are non-vegetarian can get this form through their diet. So salmon, if you consider 100 grams of serving of salmon, you are going to get about 520 IUs of vitamin D. Tuna, you will get 253. Eggs, one medium egg, you will get only 40 IUs. Then calf liver gives you 40 IUs. Milk, if it is fortified, you get 100 IUs. And butter, you get 4 IUs. So it's not a very very recommended or a very highly available form, especially for vegetarians. But there is some which is available through the food also. Now, nowadays, we are actually hearing a lot about combining vitamin D along with vitamin K. If you have seen, even in our practice also, or if you have ever talked to the nutritionist, or if you have gone in any nutrition practice, they normally give you the combination of D3 plus K2. Now, we are going to see exactly what that K means and why it is being given in the form of D3 plus K2, why it has been combined with K2, and how it is beneficial to combine K2 along with D3. Now, what K means, what is the vitamin K means? It's the German word for coagulation. So K is not potassium, which is usually it's mislaid too, but it's not potassium. It's actually the form of coagulating factor, which is, it's a German word, coagulation. So it's made, vitamin K is, when it is combined with D3, that means it is a fat soluble vitamin. And it's just like vitamin D, it also comes under the family of 3, that is K1, K2, and K3. So K1 is called, it's called phylloquinone, K2 is the menaquinone, and K3 is the menadione. So along with these 3, K1 and K2 are most used rather. And out of K1 and K2 also, K2 is one of the factors which we are going to focus more on. Now, what is phylloquinone? Phylloquinone is something which comes from the plant-based. So these are the plant-based derived or which comes from the green vegetables or certain types of vegetables. K2 is mainly the fermented food, or it also comes from the animal source. And K3 is more of the synthetic form of K. Now, K1 is usually highest in leafy greens and very small amount in the dairy. So if you're considering K1, that is something which you can take it from the leafy greens as well. Now, do our body have a capacity to convert the K1 to K2? Yes, we definitely do. That conversion happens in our intestine, in our guts, basically. So, but in some individuals, again, if you have any kind of compromised situation, or if you have problems related to your digestion, then that K1 to K2 conversion may not happen up to the fullest, which is needed. Now, K2 is a form which comes from the fermented food, which is the natto beans, and natto beans are very well researched for the K2s, and those are called Japanese beans. There are supplements are also made now using the natto beans. Then there are sauerkraut, cheese, egg yolks, butter from the grass-fed cows, and chicken liver, breast, ground beef. So these are all the animal form. These are all the animal-derived form of K2 or animal-derived form of supplementation of also K2. Then K3 is a synthetic form, as I mentioned, it comes from K. Now, RDA values for men is recommended up to 120 micrograms a day, and RDA for women up to 90 micrograms a day. So daily value, you can go all the way up to 80 micrograms. Now, if you try to consider the difference between K1 and K2, why should we be using K2 over the K1? So first of all, the bioavailability, if you consider the K2 is directly preferred rather than making that conversion from K1 to K2. Now, K1 is made of single molecule, which is called as phylloquinone, and found, as I said, found mostly in the plant food such as leafy greens. And this is the first form which participates in the blood clotting. Does K2 participate in the blood clotting? Yes, it does, but it does not affect if you are taking, and again, this is a very broad statement I'm making, you must check with your doctor when you are trying to take K2 plus D3 combination, especially if you're on blood thinners. So do not take my word, what I'm talking here. You have to consider talking to your doctor when you are considering or rather thinking about adding K2 along with D3. And K2 is the multi-molecule, which is it's called as menoquinone. Now, this when I'm saying multi-molecule, it also comes that subcategory of family that is MK4, MK7, MK9. Now, the most attention is more on MK4 and MK7. MK9 you will not see considering or rather taken into the consideration. But when you are taking K2, they are mostly talking about MK4 or MK7. Now, even in between MK4 and MK7, MK7 has a more importance given. And it's the reason behind that is MK4's life, the half-life or the amount it stays inside your system is smaller. That means it's quickly going to go out of our system. So half-life is like a smaller half-life in comparison to the MK7. So it needs the multi-dosing form. Like during the whole day, you probably have to take it 2 or 3 times to maintain that level, to sustain that level in comparison to the MK7. So that's another reason that MK7 is more preferable form of K2 than the MK4. And it's mainly found in the animal food, fermented food, and from the animal sources as well. Now, how does that vitamin D3 and K2 work together? How does they make a team, and how does it helpful in the calcium regulation also? Now, this is another very interesting research as well. Now, we have seen that in some menopausal women, or the researchers have found that in menopausal women, like multiple women who, when you go to the OBGYN, and if you're postmenopausal, menopausal, or even for men, after a certain age, they try to take calcium for your bone health, because when you are aging, your bones are getting compromised, or when it's actually getting brittle, and you have to consider the bone health as well for not getting into arthritis, osteoporosis, those kind of things. Now, when these women were taking calcium supplementation, it's been seen that these women, instead of having the bone health improved, their bone health wasn't improving. And on the top of that, they were having some arterial calcification getting developed inside. So why it is happening? Why is the reason when a woman is taking calcium, but it's not getting absorbed? So instead of getting absorbed into the bones, this calcification was happening inside the soft tissues like arteries, and those are the areas which is getting clogged by those calcium. So the reason behind that was K2. So you consider K2 as a conductor. So basically the job of the K2 is, hey, so the calcium is coming. So it basically tells calcium that, you know what, you cannot stay here in the soft tissues. You have to go inside your bones or your teeth. These are the needed categories, or this is your space where you are supposed to be. So K2 just goes hand in hand. It actually works with calcium to give him the right way to go, where you are supposed to go. You're not supposed to go in the soft tissues. You're supposed to go in these areas like bones and teeth where you're needed the most. So the primary function of that K2 is to guide the calcium, and it actually prevents that calcification or prevents the accumulation of in the soft tissues. And how does it happen, or how does it do it, or how does that vitamin K2 approaches the calcium to do it this way? So it basically activates the MGP, which is called as matrix GLA protein, and it's a very powerful inhibitor of the artificial soft tissues calcification. So that's another reason why K2 is a best guide for the calcium to go properly into your bones, rather than getting it calcified into your arteries. So that's another reason why the vitamin D3 and K2 has been given a great importance. They work together as a team. When you're taking K2, you just have to talk to your doctor. If you're on the certain certain blood thinners, then it's important for you to talk to your doctor about how much of the K2 can be taken, or how much of the K2 is necessary for you. Now, how to choose that D3 plus K? So again, this is not applicable for people who are taking blood thinners. You must talk to your prescriber before you start anything. But this is a good example. I'm not promoting any brand, but this is one of the brands which this is one of the practitioner brands rather. So when you are taking vitamin D in combination with K, as I said, K2's family, when you divide vitamin K, it goes in K1 and K2. The most bioavailable form for our bodies is K2. And in the K2 family, MK4, MK7, MK9, these are the three different forms. MK4 has a shorter half-life in comparison to the MK7. MK9 does not have much research done on it. So whenever you are combining vitamin D plus vitamin K2, the form of K2 which has been recommended is the MK7. So this is an example how to choose your supplement. So this one has vitamin D as a cholecalciferol, which is D3, which is 125 micrograms, 5,000 IUs, along with this K2, which is in the form of MK7, which is the 90 micrograms. Now, this is another example. The vitamin D of 5,000 IUs, vitamin K as K1, which is a phytonod. This can be, this is another good example of how the supplements are being made and how can you choose. So this one has K2 in the form of menaquinone 4, which is MK4 up to 1,000 micrograms as a strength. And this, the only reason behind that, as I said, that this is one of the reasons that its half-life is shorter. That's why probably it's been given in the high amount. But if you want to choose between those two, I would go with this form over this form. Because as I said, this half-life of this is shorter. So I will not prefer to go with MK4. I will go with MK7. Now, just to wind up the whole presentation, what are we learning about the key points to take? So make sure that you are taking the regular consumption of your vegetables. It's very important for you to eat greens along with your other dietary form of whatever you're taking, because they provide not only the other vitamins or minerals, it's also a good form of K1, which is getting provided. Daily exposure of sunlight, it's important. And the cases like the seasons like we are right now in the month of cold or in the cooler months, it's if you're not getting enough exposure to sunlight and if you're seeing the symptoms of vitamin D, it's a good idea to get it checked and start the action right away, either taking it into a supplemental form or in the form of a prescription from your doctor. Now, daily exercise and movements are must to see if your bones are in a proper shape. The good example is Shri Yoga's everyday movements of in the morning, what Kaka teaches us. Balanced diet is extremely important. Don't be just relying on the supplements. Most of your important minerals and vitamins, they all come from your diet. So depending upon your personal need, and I'm going to emphasize this more on, that every person is different. Do not follow the same diet for each person. It has to be according to the season. It has to be according to your personal need. It has to be according to your constitution, what is needed. So understand what your constitution is, understand what your need is. Depending upon the personal need, your diet or the nutrition should be balanced. So I hope that this was helpful to you. And this brings to our last slide of presentation. Thank you again.
Thank you very much, Alka.
So
excellent presentation.
Oh, thank you.
I have one question.
Sure.
Usually you talk about K2, but usually K2 is sometimes the tablets, calcium tablets are available with K2 rather than vitamin D3. So the one
K2
you
with
showed
calcium tablets?
Yeah, calcium tablets.
I will not go with that. No, because remember, calcium is not with the fat base. It's a water-based content. And if your K2 is added in there, that's not the right form.
Oh, okay. No. So the one tablet you have shown about the D3 with K2, where it will be available?
So Metagenics is a professional brand. If I can share my code with you on the Shri Yoga also, but it's available in the regular, if you have a specialty pharmacy nearby you, you can go there and you can get it from there as well.
Which specialty pharmacy?
So specialty pharmacies are the ones which are like compounding pharmacies, integrative pharmacies. Those are the places where you can get it. The Metagenic brands is sold. Some doctors' offices also keep the Metagenic brands, or the other brands like Pure Encapsulation, Designs for Health. They have the combinations like what I have mentioned. Or as I said, you can directly go onto the Metagenics website. They will sell only when you have a practitioner code, that to know that you are not selling randomly to anyone. So I can share my code with you all. I can just write it down here if you want to get it from there. Just buy it from there. It's Alka Deshpande. It's just one word, and A and D is capital.
What is your code?
So it's I just printed it here. I just typed it here. It's Alka Deshpande, one word. First initial is capital. The last name's initial is also capital. What is there is Namita Tirhat. What is the normal range of vitamin D? I think I answered that, but to answer it again, the normal range of vitamin D starts from 30. You're talking about the blood range, right? Yeah, so it starts from 30 all the way to 100.
Okay. Got it. 100.
Do you have recommendation on vegan vitamin D supplements? So vitamin D supplements, vegan, I know I have not seen vegan, but right, vitamin D supplementation is not a problem. It's you can take it in the regular form also. I have not seen honestly vegan form of it. How about for vegetarians for D3, just sun? Unfortunately, yes. Or unless you take as I said, if you take at least the eggs, that's another way of getting the vitamin D3 through your diet. But if you're not taking because I take D3 in the form of supplement, because I don't take, especially in the form of when during the months of winter, because as I said, I'm vegetarian, don't eat the eggs as well.
I have a question. if we do sunlight for vegetarians, then how long do we have to be in sunlight? And does it matter what
Yeah.
particular time of the day of the sunlight?
Yes, absolutely. I'm glad you asked that, and thank you for referring to that question also. So yes, why for the exposure of the sunlight, if you go early morning, it's not probably going to be helpful. But if you go around 9:30, 10 o'clock, and you stay in the sunlight for at least half an hour to 45 minutes, that's a pretty good exposure. You don't want to go in the higher, like during the noon time where the sunlights are extremely strong and harmful to your body. It's like that transition period when the sun rays are not too strong and not too mild. So around 9:30 to 10 o'clock, if you take a walk up about half an hour to 45 minutes, having a complete exposure, that's a good amount.
So for kids these days, when they are outdoors, at least say in winters, they are in a jacket, right? So probably the only area that's open is the head and the face.
Yeah.
Is that enough exposure?
Honestly, not. It's not. So that's that, as I said, that's another cases when the growing children, like giving them a vitamin D in the food or nutrition form is more important. In some areas, like in some areas where cold, when they are going out, there is a bright sun and they are getting exposure without the coats, that's fine. But in our regions, no, they are not getting enough sunlight.
And the chart that you had showed, it said 1 to 70 years, 600 IU. Is that enough for a growing child?
So actually, no, that's what I'm saying. They normally recommend 500 IUs if you see the kids vitamins, it's usually the 500 IUs. But it's a good idea that usually my pediatrician used to check, and my daughter's pediatrician used to check their vitamin D almost every year to see where they stand. And if your pediatrician is not checking, you can ask them, can you check the levels to see where your kids' vitamin D levels stand? And if it's deficient, then you definitely want to ask her about giving any supplemental form of vitamin D.
Okay, thank you.
Do the leafy vegetables in frozen form make a difference compared to like how much do they lose in terms of their?
So if the frozen vegetables are way better than canned, it's not a first choice, of course, but in winter months, it's hard to get the fresh vegetables sometimes. So it's not bad to have the frozen vegetables also. You can definitely have that. It's not going to impact. It's not going to lose the way the canned vegetables are. So it's not not a harmful thing or not a bad idea to get that through the frozen vegetables. It's absolutely fine.
Thank you so much.
Alka, I have a question.
Yeah.
So, if you get sunlight from, passing through the glass, like windows, and that be helpful or no?
Nowadays the glass windows they have tints. Remember, if there are the rays which pass through, it's still been filtered out. So instead of if you have certain areas of your home where you can get a direct exposure, I would say now rather than not having anything, it's better to actually sit in the sun, whatever you can get. But it's not going to give you the full benefit of when you go
Exactly.
out and get an exposure.
Right. Directly. Yeah, but again, in the winter time, you're covered by everything,
Yeah, as I said,
Yeah.
it's a good idea to get your levels checked right before the season and see if you need the optimal if you need any boost before the season. So you're at least covered for 2 to 3 months. That
Okay.
you're taking enough or your vitamin Ds are optimally maintained or your levels are maintained.
Okay, thank you. I'm just since I'm talking, I'm running out of magnesium and vitamin D3 right now. So
Oh, yeah.
just could do the full script, right?
Yeah, definitely. Just remind me again. I keep on forgetting about that.
No, that's okay. I will remind you.
There is also one vitamin capsule that we see in Costco, which is the wider artery health with vitamin K2 plus D3. I don't know if you are aware of that or any thoughts on that.
Vitamin K2 plus D3 that's not a bad idea at all because as I said, it works together. I'm not just aware of the brand and how much is in there.
Okay. It has 90 mg of vitamin C, 5,000 IU of vitamin D, It has B1, niacin, it has, and K2 is actually 180 mcg. So
Yeah, so that's a pretty good amount. So if you're taking such kind of supplement together, D3 5000 and K2 is about 180 micrograms. If your levels of vitamin D are good, and when I'm saying good, that means if your levels are close to 40 also, this type of supplementation, this type of dose, you can actually take alternate days, or you can take it 2 times in a week. You don't have to take it every day.
okay, thank you so much.
But niacin is a good, see, the thing is when they are combining D3 along with niacin, I'm not a very big fan of that because you are combining fat soluble vitamins along with the water soluble vitamins. So that's, if you ask me, would I take that? No, I won't.
Thank you.
Any other questions?
I have a question. This is Anjali.
Yeah.
Question is, how would I know that I need to take, currently I'm taking D3. How would I know I need to take with K2?
Have you checked your bone densities, Anjali?
I think so. I'm supposed to be going for next month for my
Okay, so
blood.
there are 2 things you can ask your doctor.
Okay.
First of all, see if your bone density is intact. If you're prone towards, or if you are any possibility of osteoarthritis or osteoporosis, that's one of the good ways to know if your calcium or vitamin D is used properly. The second thing is, and which is a very nice thing, which has come up with the new technologies or new research now, is to do the calcium scoring of your heart. So that actually gives you an idea how your arteries are, if you are any deposits or if there are any blockages or possibilities of blockages. That's a very early detection of your heart health. So you can actually ask your doctor to see if you are eligible for the calcium scoring as well. So that will give you.
But now let me just use the right term. I don't want to forget one word and it will screw up my report.
Sure.
So my question is, should I ask a calcium scoring in heart?
Yeah, just say
should.
calcium scoring. And the second thing is the bone density. Just
Okay.
check those 2.
Okay. All right. Thank you.
No problem.
I have a
Alka.
question. I have a quick question here. When she was talking about heart calcium scoring, what is the normal range of the heart calcium?
So they have the ranges given according to the ages. They will tell you what your highest score and what your lowest score.
Okay. And if it is high, then what happens?
So if it is high, they will tell you what the next procedure is going to be, where you are and what are your next steps. So again, I'm not going to give you any medical terms here because we are not going to talk about that, but your doctors will definitely guide you through. If they are seeing any kind of high scorings, definitely guide you through.
Okay. Thank you.
No problem.
Wonderful presentation.
Alka.
Thank you.
Okay, so I'm just curious to find out. I just did my calcium score and it came perfect. It's a 0. But the doctor prescribed me the medicine for the high cholesterol.
So they put you on the statin?
I'm taking those 2 vaccine.
Okay, so there must be another reason if they're because sometimes they ask you to take that for the prevention. In some cases, they ask you to take it for prevention. So it depends upon doctor to doctor.
Okay, look like it's for the prevention, most probably. Okay, thank you.
Any other questions? Well, I think Kaka, it's up to you now.
I'm sorry?
Sabnis Kaka, it's up to you if you want to close the session.
Yeah, if there are no more questions, then we can close the session. Yeah.
Hey, hello Alka, this is Priya Mahata. What is the food source for phosphorus, you said?
I'll send you the list, Priyati.
Oh, great.
I have your number. I'll send you the list.
Thank you. And I wanted to mention that D3 and K2 combination is available on Amazon.
Yeah, it is available everywhere. It's
Yeah.
just you just have to choose a right brand. That's all.
Right. Huh.
Alka,
Thank
I
you.
don't mind getting that phosphorus list as well. I don't know wherever you'll put it. I'll like one too.
I'll share it with Kaka otherwise.
Okay.
I have
Yeah, I
his
think
number, so I said I'll give it to you.
you are on the yogic neuroscience, right? Okay.
I
Yeah,
am.
So
I'll
I'll
share
post
it
it
with
there.
I'll share the list of magnesium and phosphorus both.
Okay.
Okay.
Or if you want calcium, like calcium, magnesium, phosphorus, I'll put a note here.
Okay.
Thank you.
And this session will be recorded, recorded, and will be available soon. And I'll post it both on Shri Yoga and also on the. Some of you are on the BMM Self Care group, so I'll post it on BMM Self Care also.
You will post the code also, right, Alka?
Huh?
You will post the code also. Code.
I think we did.
The code
Yeah,
that she already she has put the code in the chat box.
Oh,
If you look at the chat, then there's like the code is there. It's her name and where is that?
yeah, it's Alka Deshpande. It's just one word. And the first letter of my first name is capital. The last letter of my last name is capital.
oh,
First
okay.
letter of the last name.
You also talked about this magnesium spray. Can you also tell us a little bit?
Yeah, so magnesium spray, I personally like it for if somebody has the muscle issues, like if you are sore muscles or if you are getting more often the cramps in your muscles. So the magnesium spray is also available to put it at nighttime before you go to bed if you have any sore muscles anywhere.
I
And
see.
you're taking a magnesium supplement, it's not enough, or dietary magnesium is not working that well, and that soreness is not going away. Then you actually get, I think now brand you sells the magnesium spray. It's also available through various different brands now, but all you have to do is just spray it on the sore muscles. Or if you have a tendency of getting the cramps at night also, you can spray on your legs and then go to sleep. That's another way. Or the other easiest way is to soak yourself or immerse yourself or foot soak in the Epsom salt, which is the magnesium salt.
Thank you.
Thank you.
Thank you so much for
Thank
your
you so
presentation.
much.
Thank you. Thanks
Have a good night.
Okay, good night, everyone.
Good night. Good night.
Good
Thank you.
night, and thank you very much.